How you doing, guys? This is Dr. Specific Chiropractic. In this video, we're going to talk about deviated septum and post nasal drip. So go ahead, tell the viewers your story. What happened?
I had issues with sinuses, post nasal drip, and breathing. I had surgery. Surgery has not helped. I'm still having issues with breathing and congestion. And I found Dr. Sue online. I said, let's give it a try. Let's see if that will help my situation.
Okay. And also, let's clarify. So you had already deviated septum surgery the first time.
Yes.
Okay. And what happened afterwards?
Afterwards, it was okay maybe for like a week or two. And then I'm back to the same congestion, issues with breathing, post nasal drip. So it's like the surgery didn't help at all, unfortunately.
Okay. And what did they suggest the next time?
After surgery was a lot of nasal sprays. Just try this spray, that spray, nasal wash. Nothing's helped at all.
Gotcha. Okay, let's take a look, see what's going on. Try to remember. Now, you mentioned about you've been having a lot of post nasal drip and sinus issues.
Correct.
Before the surgery.
Yes.
And you still continue to have it afterwards. Correct. All right. Okay, so when I hear a thing like that, okay, then we have to investigate some areas. So some areas of the spine is this region right here. Okay. That's typically responsible. And the story is this: if there is some kind of nerve dysfunction there, what it could do is cause the mucous membranes not to function properly, as you see over here, here, and here. Okay. Now, that's one aspect of it. Okay. The other aspect is also what's going on with all the bones in our face, in our skulls. So the way the sinuses work, right? Ideally, with all the bones, we want everything in proper alignment. Okay. Now, however, if your skull does get misaligned, it can be like that. It can cause a little ledge. Okay. Now I'm making this a little bigger so it's easy for everyone to see. But actually, it's very minute. Very minute. We're talking like not even 1 millimeter. It's like 0.5 millimeters, 0.2 millimeters. It's very subtle and slight, but it's enough to cause turbulence because air is supposed to flow this way. Right. Okay. But if it catches around here, what happens? There's some debris gets built up here. Okay. So now, how does the body get rid of that? Well, if this was in proper alignment with the proper air force, your body just simply blows it right out. Okay. You have to sneeze it out or blow it, and with tissue, so on and so forth. Now, if it still doesn't do it, and it still continues to build up, then our body goes to the next level. The mucous membrane has a lot of white blood cells in the area, so it starts to try to dissolve and break down all the foreign contaminants in there. Okay. If it's prolonged period of time, then we have some other fun components that you may have been told by your ENT. Okay. May start developing some polyps.
Ah, yes, I've heard of that.
Okay, so what polyps are is just more like your mucous membrane expanding, going more, and then what it's trying to do is increase more surface area to try to bring even more white blood cells to try to dissolve and break down that foreign stuff that's stuck in there. Right, okay, that's its natural body reaction. Okay, so now here's the thing: if it's still misaligned, and sometimes the surgeons they'll go in there and they'll cut these polyps off, which I understand it is can be a benign benign growth in there. That's what they'll try to trim it off, but it's not going to solve the problem. Right. All right. Okay. And therefore, that's why we want to check your nerves and how everything's working in your bodies, because here's the thing, every time we breathe, just like our rib cage over here, when we breathe, the rib cage expands and contracts. Our skull does something very similar as well, because all the cerebrospinal fluid needs to feed and nourish the brain itself. So therefore, all our skull pieces, it's not just one skull bone, there are multiple pieces. It also needs to expand and contract every time we breathe as well. Okay. So therefore, if it's not getting appropriate communication, sometimes the bone, it just gets stuck.
I see, okay.
And gets misaligned and causes all these cascade problems. So that's one aspect of it. Next component is this region over here. That's where the trigeminal nerve likes to stay put. Okay. So, but here's the thing. Okay. If there's an issue with the trigeminal nerve, and also the facial nerve, it needs to innervate and make sure your sinuses are working properly. If it's not, then also contributes more to this mess over here.
Okay.
All right? That's why it's a double whammy. We're gonna take a look, closer look, see what's going on over there, that region over there, and innermost in the spine to facilitate that drainage.
Okay, good.
As we discussed before, okay, since you still have the post nasal drip, got a lot of mucus going on, sinuses, the whole entire 9 yards. So you want to investigate what's going on in this region over here.
Okay.
You know, upon a closer look, this fifth cervical is not in proper alignment. I want to see things moving in a proper curvature, but number 5 over here is tilting more backwards in relation to everything else.
Okay.
So that's one potential candidate I want to take a closer look at. Okay. And when I do want to see how is the foundation, how is the structures that's supporting it below it. And when I trace down, I see a lot of arthritic changes around here.
Okay.
And it keeps on going all straight down and it stops around here. And then when I take a look here, okay, we got one heck of a scoliotic curvature with a lot of arthritis going on over here. Okay. So when I take a closer look at that one, it says, what happened? The whole entire right hip is tilted downward this way.
Okay.
And this line over here, it's shifted. Instead of being the center, you're offside to the right.
Okay.
So therefore, your whole entire hip and body, you rotated this way. And we can't walk this way at all.
No.
So the head has to be forward this way. So that's why your body, it has to start twisting to compensate.
Okay.
And that's what we see over here. So the rest of your body, sunk down here, you rotated this direction, counter twisted this way, counter twisted this way, and counter this way over here. And that's where we see a lot of arthritic changes on here as well. And that's what caused that fella, just like a washcloth is being wrung right over there. So actually, I want to take a closer look, see what's going on here and here. Maybe here, but I have a feeling that when we deal with these two fellows here, this area should start calming down.
Okay.
You see that over there?
Yes.
Okay, that's your deviated septum. That should be actually a nice straight line. But you see, it's like an arrow. It's pointing over to the left.
That is not straight.
No, it's not. And also, I want to see your sinus cavity clear like this. But you see this? Yeah, there's some junk in there on the left maxillary sinus.
That is horrible.
Yeah, so that's why. Most likely, it's this side is going to be all filled up. We'll take a look. Okay. See what's going on this side over there as well.
Okay.
We're going to start off with visualization. That means I'm going to inspect, see where there's any potential areas of swelling. Okay, there's some swelling right over here, quite a bit. Trace it down. A little pitting edema at this level, so we're going to mark that level. Trace everything all straight down. We have some pulling here on the right side, the sacroiliac joint. So we'll also get a closer look, see what's going on in that part there. So we start scanning your spine. See what's going on over here. Find any potential fellows we're going to take a closer look at. So the swelling's still here. This one over here, this hip, it's not moving too well.
Oh, really?
Yes, Jane, see, your left one is moving just fine. Sacro's move fine. That one is not. See, this is Marter's fixation on that 6th dorsal here. Feel that little bulb right there? A speed bump? Yeah. There's a lot of swelling on that, on that left side there. Also on the right side as well. You feel that right there?
Oh, yeah.
Yeah, that fella's not moving.
Oh, boy.
How's that?
Ooh.
Not too fun, huh?
No.
Yeah, that's a 5th cervical right there. Everything else moving just fine. Relax your shoulder. Yeah. There's a piece. Relax your shoulder. There's that fella.
Ooh.
Relax shoulders. Relax shoulders. A little more. Just come on up.
Wow.
I know that one, firecracker.
I heard that one.
Okay, go ahead, walk around.
Ooh, boy. I didn't expect that. That was different. I heard the crack too.
Yeah, I know, that was a big one. Tell me, what's different about, try your breathing now.
Ooh, it's a lot better. A lot better.
Compared to before to now.
Yeah.
How much of a difference would you see?
Not 100%, but I can breathe. It doesn't feel so congested.
Okay. Well,
a lot better.
Ballpark, how much would you say?
90%.
90%, hey? Let's get the rest of it.
Yes.
Now, because they did surgery on this one, okay, we're gonna be a little careful. But we still gotta set it. Right here, a little bit. And then now the nasal bone. A little more. There it is. Now, feel this difference over here? This one, the right side, is moving just fine. Feel this one? This is not moving at all.
No, yes.
This is the one that's really swollen and inflamed. Okay, got a little more. Good. Same story as this one, okay? Left frontal sinus, it's all stuck. A little more. Okay, sphenoid. Yep, this is a little, yep, see, this is not pivoting. A little more. A little more. There we go. Okay, go ahead. Come on up.
It's better. Better than before.
Okay, so compared to before to now, how's it now?
95%ish. It's a lot better. I don't feel as congested, but I can breathe.
How's that post nasal drip?
It's gone. It's gone.
Pretty nice, right?
Yeah, it's good.
Isn't that nice to finally turn that faucet off?
Wow.
All right, well, that's what the story is. Okay.
It's good.
Well,
Thank you so much.
you're very welcome. Well, all right, so have a good one.
Thank you so
See you
much.
next time. Okay, boom, done. That's it. That's easy.